Everything you have ever wanted to know about the thyroid gland. Normal function, pathology, and treatment options.
Thyroid gland anatomy.
Location, lower front of the neck.
Butterfly-shaped gland. Composed of two lobes connected by an isthmus. Normal function of the thyroid gland is the production of thyroid hormones. T3, triiodothyronine, and T4, thyroxine. The thyroid also regulates metabolism, energy, and body temperature. Has a huge role in growth and development, especially in children. The thyroid hormone is often called the master hormone due to its many effects it has on the regulation of our body functions. Thyroid-stimulating hormone, TSH, is secreted by the pituitary gland.
Negative feedback loop maintaining hormone balance.
Thyroid pathology, overview. Number 1 is hypothyroidism. Number 2 is hyperthyroidism. Number 3 are thyroid nodules and number 4 is cancer. Hypothyroidism. Symptoms: fatigue, weight gain, cold intolerance, hair loss, and depression. Causes: Hashimoto's thyroiditis, iodine deficiency, and thyroid gland removal. Hyperthyroidism. Symptoms: weight loss, heat intolerance, tremors, and anxiety. Causes: Graves' disease, toxic nodular goiter, and thyroiditis. Thyroid nodules. Definition: abnormal growths within the thyroid gland. Types: benign and malignant. Evaluation: physical exam, ultrasound, and fine needle aspiration biopsy. Thyroid cancer. Types: papillary, follicular, medullary, and anaplastic. Risk factors: exposure to radiation, family history, and certain genetic syndromes. Diagnosis: ultrasound, biopsy, and imaging tests. Treatment options for hypothyroidism: hormone replacement therapy, levothyroxine. Needs regular monitoring of TSH levels when taking levothyroxine. Treatment options: hyperthyroidism, antithyroid medications, methimazole and propylthiouracil. Radioactive iodine therapy. Surgery, thyroidectomy. Treatment options for thyroid nodules. Monitoring of benign nodules. Surgery for malignant nodules or symptomatic benign nodules. Treatment options: thyroid cancer. Surgery, total or partial thyroidectomy. Radioactive iodine therapy. External beam radiation. Chemotherapy and targeted therapy, for advanced or aggressive cancers. Conclusion: importance of maintaining thyroid health includes proper diet, exercise and regular self-exams of your neck area, and when possible, if symptoms arise, it is important to have your TSH levels checked if indicated. It would also be very important that since low levels iodine are the most common cause of thyroid goiters, you might want to supplement daily with iodine, since as a whole most of us are deficient in iodine due to all the processed foods we eat. We encourage all of our clients to seek medical advice for symptoms of thyroid dysfunction. Thanks for watching. Dr. Treds Slim Body Laser Spa 772-223-5885